The last thing that's important to know is the type of health insurance you plan changes how you can access your care and what's covered. There are two major types of health insurance plans, HMOs and PPOs. HMO stands for Health Maintenance Organization, while PPO stands for Preferred Provider Organization. The name isn't really important, but there are important distinctions between them. Generally, you have lower premiums for an HMO because you have less flexibility in how you can access care. With an HMO, you are required to see your primary care physician before you receive other services. So let's say you hurt your knee and you wanted to go see a physical therapist. If you had an HMO, you would be required to see your primary care doctor first to get a referral to the physical therapist. You couldn't just go on your own if you wanted your health insurance to cover it. You also are required to stay in network with an HMO. So out-of-network care is not covered with an HMO plan. What this means is that you have to go see the providers that your health insurance company has contracted with to provide services. If that physical therapist that you wanted to see was not in your HMO network, your health insurance plan would not cover it. So again, less flexibility, but often for a lower premium. You pay less for that coverage in exchange for less flexibility for your services. The opposite is true with a PPO. With a PPO, you have more flexibility, but you also pay a higher premium for that flexibility. So with a PPO, you are not required to see your primary care physician before you receive other services. So if you hurt your knee in a PPO, you could just call up the physical therapist and schedule your appointment yourself. You wouldn't need to see your primary care physician first. Now, this doesn't mean that the physical therapist couldn't require a referral, just that your health insurance company doesn't, okay? Also with a PPO, you can go out of network for care at a higher cost or higher co-insurance or copay. So if the physical therapist that you wanted to see was out of network with your PPO, you could still see them. You would just have to pay a higher copay for those services. So when you're trying to choose between plans, you really want to think about how much flexibility do I want? Do I want to be able to schedule my specialist visits on my own, or am I okay with needing a primary care physician referral first? And who is in the network? Am I going to have to stay in network? And are the providers that I want to see or need to see within that network? If you need a specialist that is not covered in that network, then a PPO plan may make more sense for you.